like this. Do you offer en-bloc capsulectomy? If so, will the tissue get sent off for testing? So yes and yes. Well, I say yes. A lot of people ask about en-bloc capsulectomy. We do offer, we can do en-bloc capsulectomy. So in case you're wondering what en-bloc capsulectomy is, we're talking breast implants here. Breast implants get coated in a capsule. It's normal. It's what the body does when you put something inside the body. It walls it off in scar tissue, and that's basically what the capsule is. It's just your body scar tissue. And when patients develop what's called capsular contracture, hardening of the implant, it's called a capsular contracture, and you can remove that capsule and replace the implants, and that's called a capsulectomy. So a capsulectomy is actually quite common operation to do, and a total capsulectomy is a common operation to do, where you remove all of the capsule and put a new implant in. This en bloc term has come more recently from patients, particularly I think it's from patients, I don't know who this patient is and I don't know why they're using the term en bloc, but it's particularly patients who are worried about breast implant illness, which is a condition where people who've got breast implants in describe symptoms such as brain fog, lethargy, joint pain, skin rashes, hair loss, and they feel that they're related to the implants. There's no medical reason to say that implants can cause these. Nevertheless, there's women out there who describe this. It's called breast implant illness. And when they develop breast implant illness, they want the capsule removed en bloc. Now, an en bloc capsulectomy means that you remove the capsule with the implant inside and you do not breach that capsule. The problem with doing that is that, I don't know if you can imagine this, but you've got to use a much larger incision to do a proper en bloc capsulectomy, taking the capsule out as a specimen, almost like a cancer. En bloc is really a cancer term when you do an en bloc resection of a tumor, that you don't really want to cut into the tumor, so you cut out everything around it. You take the tumor out en bloc, as it were. And it's not really appropriate in terms where there isn't a tumor, because if you don't do an en bloc capsulectomy, you just do a total capsulectomy, if you incise that capsule, then you can take out the implant. The implant's usually not hard. People think the implant's gone hard when you get a capsule. The implant itself is not hard. It's just made to feel hard because the capsule, the scar tissue around it has contracted around it. So you can make a much smaller incision if you can just cut the capsule, take the implant out, which will then kind of deform because the implants are squishy, and then that capsule has lost its form and can come out. You can still do a total capsulectomy, but you don't have to do it en bloc. You can do a much smaller incision than if you were doing it en bloc. Now, the only condition where an en bloc, I guess, would be much more reasonable is if you were doing a lift. If you're doing a lift at the time of the capsulectomy, then it's not unreasonable to do an en bloc because you've got much more exposure, the incision is much bigger, and it's much more appropriate to do a total en bloc capsulectomy. It wouldn't be so much of a problem. But if you're not having a mastopexy, if you're not having a lift at the time of the capsulectomy, I think it would be, personally, I think it would be absolutely fine to just do a total capsulectomy, make an incision in the capsule, remove the implant, and then remove the capsule kind of separately. It's a much smaller incision, and you're still getting all of that capsule out. There's no reason to not want to breach that capsule because, as I say, you're not really dealing with a cancer. You're not worried about seeding cancer cells or anything like that. So I would say it is very rarely required, particularly in situations where you're not doing a lift. But if you ask the question, do we do it? Then yes, we do. And the second part of the question, if so, will the tissue get sent off for testing? Well, the answer is yes. And this is one of the indications about ALCL, which is this cancer that's come about from breast implants. And you got to ask yourself, where has it been all these years if there has been a cancer associated with breast implants? Now, breast implants have been around since the 60s. So why has this cancer only been around for the last, I don't know, 5, 6, 7 years? Probably more than 5, probably 7, 8, 9, I don't know, 7 or whatever years. And one of the things is that we're now aware of it, so we will always send off the capsule, whereas back in the day, we didn't used to send the capsule. It was just scar tissue. Why would you send it for histology? So we never sent it for histology. And God's sake, can you hear that? I hope you can't hear that. What is he doing? We never used to send it for histology. Okay, so maybe there was ALCL there, which wasn't causing a problem because we didn't know because we didn't send it for histology. And now, not only that, when you send it for histology, you have to specifically ask for ALCL. They have to look for it. So if you go looking for it, it might be that you're finding it now, and but whereas we weren't finding it before. But it kind of, there might have been cases where it wasn't causing a problem. We don't know really. That's the answer. But anyway, in answer to your question, yeah, we routinely send it off histology. You don't have to ask for that. That's a routine thing these days, sending the capsule off for histology.